All this is Dr. Mobeen Sayed from drbeen.com. This is right in the morning, but there is a news that kept me awake for the night as well, and that was there has been a news that is there is a sharp increase in the cases, severe cases for children in Gauteng, South Africa from Omicron. And I wanted to make sure that I discuss this and I look at the data and news with you together. There is very tiny data available. So I'm going to share that with you. And there is a lot of news available, which is going crazy as usual. So I want to make sure we look at it, and please make sure if you are parents. I'm not a parent of 5 years old. If you're a parent, please make sure that you talk with your doctor, be aware of the situation, make sure you protect them. Children are the most precious things for us ever. So please be very, very careful. Do not take any risks. If you can protect them with vaccine, do that. If you can protect them in any other ways, do that. But please protect yourself and protect them. Let's look at very quickly the data itself. And my apologies, this is right in the morning. I think we are just having the sunrise. So here are a couple of important things that are out. Number one, the remember Dr. Um, Angelique uh, Kutsia of South Africa, who was the first doctor who talked about the uh, Omicron, and then she said it is in extremely mild cases as well. She spoke with some newspapers, and I'll show her statement. And she said that she is hearing that the R naught is greater than 6. Now, Delta had an R naught or reproduction number or spread number from 3 to 8. So, if Omicron has reached 6 or greater, it looks like, and we already know it is more transmissible. Still, what is really missing, sorely missing, is the outcome in the patients. What is it doing to the patients? That is the most important thing to understand how to react and how to respond. Now, children under 5. So, I'm going to show you this. This is Dr. Wassila Jassat from South Africa. And she said in Gauteng province, where the Omicron was first detected, she said the children under 5 years of age in the hospitals are the second largest group after 60 plus. So it seems like that there is an attack on the children. But I want to make sure that we look at what may be possible. As the data emerge, we'll know more. The WHO responded and they said that we do not have enough outcome data. That means what happened to those children before we can say how worried or not. So I'll show you those references. And then I'm going to do a quick discussion about what may be possibly the cause. So let's first look at the references themselves. So this is I could not find this data from somewhere. It seemed like an online data, but please pay attention for a second. So this is Dr. Wassila Jassat. She was talking with the NBC Bay Area. So NBC Bay Area, I am in Bay Area, so it is here. And look, she said incidence risk of admissions per 100,000 by age group and epidemiologic week or and something Gauteng or Hoteng. And if you see here, this blue one is under 5. The incidence here, admission incidence, is actually the numbers are here 0, 2, 4, 6. So I believe between 4 to 6, or maybe about 5, is the incidence at this time, and the data is here. So that is a hospitalization. Again, numbers are small, but you can see that she used the word sharp increase, and yes, you can see the sharp increase. Then on the right side graph, the top, I'm assuming it is not very legible, but here greater than 60, the colors are not legible or differentiable from each other. I'm assuming from her statement that the top group incidence of admission is 60 plus, so I'm assuming this is 60 plus. And if you see here, this number is about 6, between 6 to 7, so it's 6.5. And then below that is the children under 5. And again, if you see, they went up from here to here, so it is still a smaller number between 5 to 6, and but it is increased. So that is the important thing to keep in mind, that one, yes, there is a rise. Secondly, there is a uh, the incidence, the number is still small. Now, continuing with this incidence, so this is Gauteng province's numbers. This number was a small number a few days ago. Now it is 11,554 new cases on daily basis. And then you can see that there is a surge here that is showing as well. We've seen this graph before as well. These are the number of admitted is blue, admitted to ICU. Sorry, deaths are blue. My apologies. Dark blue is admitted. Admitted to ICU is red, and then light blue is on ventilation. So it doesn't, admissions seem to be higher, but people on ventilators or in ICU does not seem to be increasing. So again, if this severity is increased, but it does not move towards death or towards ICU, then that will be good thing as well. Now, continuing, this is once again South Africa's data, and it is showing a rise in the numbers. This is South Africa's data, but about death. And if you see here, I have actually, this was the graph and I made it larger for us to see it. If you see here, this is November 25, and since November 25, the deaths had increased after November 23 from 20.29 on that day to, is this 7-day moving average? 7-day rolling average. So from 20.29 7-day average, it went up to 36, then it stabilized to 31, and now it has actually dropped. December 2 is 20, and December 3 is 23. So it has actually dropped. Then this is another piece of news. This is CBS News, and I wanted to read this to us. This is all these children. This is, we're talking about Gauteng, South Africa. All these young children being admitted, most of them, the parents have not been vaccinated either. So I think certainly the value of vaccination in the adults, protecting the children in the homes, is something to keep in mind, said Jassat. So this is the same Dr. Wassila Jassat that we talked about. The other thing that is interesting for me is this. So there was a conference by WHO. I think they have a weekly conference. In that weekly conference, this is what they said: we don't have the outcome data for those individuals. So outcome data is important. Actually, I keep scouring every place as well. You can tell that right in the morning. The very first thing I'm doing is looking at these things and discussing them. Evolving data, I may be off here because I'm going off of mostly news instead of actual data, and I don't have that data yet. So anyways, they said outcome data is not there. So I got COVID. Fine, that happened. Now, what happened to me is very important. If COVID came in, became mild case, and I am okay, that is fine. But if it killed me, then we have a problem and we need to figure that out. So outcome data is not there yet. So we haven't seen an increased risk of death yet. So we have to wait to understand how those patients will do. The World Health Organization's Dr. Maria van Kerkhove said on Friday, when she was asked about reports of rising hospitalization among young people in South Africa. So this is that video, and I have the link in the discussion as in the description. So with this, one last comment, that what may be causing this spread, and again 5-6 incidence rate looks to be that way. One is community spread, that if the virus itself has become more transmissible, that means it is going to go to more adults, and then those adults are going to bring it to children, then children are going to give it to other adults as well, and so that cycle continues. We can say that this may be a reflection of a higher community spread. But still, what is interesting is, why 60 plus and under 5? There must be some community dynamics that can explain that. That is one. Second, is it possible that the parents are nervous and they are on the edge? They are worried about their children, and on the very first sign of any problem, they bring them to the hospital, which is totally fine. I remember that when I had first child, we would go to hospital even if we would sneeze. And they finally, the doctor said to me, because I was studying in medicine, so he was a professor of medicine, pediatrics as well. So he finally said that, hey, your son doesn't need much treatment. It is you he needs who needs to understand. So nervous parents maybe. variant fit for children? Is it possible that those mutations have actually made them better for children? Remember, the previous variants were not fit for children. They were not able to do a lot of damage to children because the children's natural killer cells were responding better. Number one. Number two, children had the cross immunity in their systems that was helping them. And then number three, the ACE2 receptor density in their cells in the nasopharyngeal area is less. However, if these set of mutations have made the virus, even when the ACE2 receptor density is less in the throat area and nose area, but still the virus can more avidly connect with them. So then maybe the virus has a chance to cause the infections. So that may be one reason. It may be another reason that virus can so quickly connect with the cells and infect them that natural killer cells are beat. They cannot do much before they rush to the virus and kill it. The virus has already entered this cell and started infecting it. Maybe this is just a conjecture. If we suspect it is something to do with the mutation, then is it the vaccination status? Is it the children not vaccinated, the parents not vaccinated, the community not vaccinated, or are there other factors? We don't know yet, but there may be many other factors. So what should be concerning is that children's cases are rising. What is less, what can give us some ray of light is that number is less, number one, and what should keep us curious is that we do not know the outcome. So over this weekend, as you read these news and you become a little nervous, number one, please be careful to keep your children safe, keep yourself safe, and number two, keep an eye on the outcome. That is what would actually tell us how the things would unfold. So thank you very much. I hope you stay safe, happy, and healthy. um, my voice is still not fully warmed up, so my apologies for this voice as well. And let's go from there. So this is possible. So a few questions and then we stop. AJ Lakau says under 5 and over 60 baby grandchildren, and maybe that is possible. um, Anita says, Dr. Bean, if this is highly transmissible and less fatal, could getting infected with this variant and recovering naturally make us immune to all other mutations? Ideally, we can't say the future mutations, but generally, also not immune, but we get very good protection from previous infection. So Mr. George says, I watched Dr. Daily. I've never seen so many deleted comments. I'm not deleting any comments. I am actually speaking with you right now. So I think sometimes YouTube itself holds the comments as well. John says, do you ever sleep? I think this was very, very important for us to talk about. That yes, there is a rise, and that is some Matt said this is disinformation. How is this disinformation? We're talking about a doctor from South Africa talking about the sharp rise. We should at least be able to look at that and discuss it. If we say disinformation, we just dismiss it and we make ourselves not even able to be aware and respond. So now what says, seems like SARS-CoV-2 affects young children the same as other HCOVs, human coronaviruses. They are human coronavirus naive for a time too, after all, so it would make sense. Possible. And again, important thing is the outcome. If the outcome is the child got little sick, then in a day or so they became okay and they're back, so then it would continue to look good, the Omicron. But if it starts actually damaging the children, then we would have a problem. All right, so uh, this is where we are. Thank you very much for hearing me out right in the morning. Now I'll go get my coffee and other things. This thing had kept me awake for the whole night. I was trying to find data, did not find it, but finally I found this chart where there was at least some incidence rate that was present. Please keep an eye on the incidence rate and the outcomes before anything else. Thank you very much. Have a nice weekend, and I would speak with you hopefully on Monday, unless there is some other breaking news. Thank you. Bye bye. And please like, subscribe, and share. There are 3 links in the description if you would like to support this work. Your support can not only help you have these talks, but we produce lectures for medical professionals, students, and others, and your support is actually getting them information too and knowledge too. So there are 3 links in the description. You can buy me a coffee, or you can use PayPal, or you can become a patron. Thank you very much. See you again.